After menopause, the most dangerous blood pressure reading is not always the highest one. Sometimes it is the one you keep explaining away. You blame the machine. You blame stress. You tell yourself, maybe it is just my age. But if that number keeps coming back, even slightly high, your body may be trying to tell you that something has changed. Your sleep may have changed. Your salt balance may have changed. Your blood vessels may have changed. Or even one of your medications may now be affecting you differently. Hello, I'm Dr. Claire Bennett. Today I want to talk with you about why blood pressure often changes after menopause, why the numbers can seem so unpredictable, and what you can do next without panic, guessing, or changing medication on your own. This is not meant to frighten you, it is meant to help you stop guessing. Because once you understand the pattern behind your blood pressure, the numbers begin to feel less mysterious, and you can have a much clearer conversation with your doctor or pharmacist. Before we go deeper, I want you to do something simple. As you listen, choose one word that may describe your own pattern: morning, sleep, salt, stress, pain, or medication. Just keep that word in your mind. By the end of this video, you may realize that your blood pressure is not random at all. It may be following a pattern you simply have not been shown how to read. I have met many women who come into the clinic with a notebook full of blood pressure readings, and they look worried before they even sit down. They say, "Doctor, I do not understand what is happening. One day my blood pressure is fine. The next day it is high. Then it drops again. I am eating almost the same foods. I am still doing my usual errands. I do not feel seriously ill. So why is my body suddenly acting this way?" That is a very fair question. And if you have asked yourself the same thing, I want you to know that you are not alone. For many years, menopause is described mostly as a reproductive change. People talk about periods stopping, hot flashes, night sweats, mood changes, and sleep problems. Those things matter, of course. But menopause is not only about the reproductive system, it is also a turning point for the heart, the blood vessels, the metabolism, the nervous system, the way the body stores weight, and the way it responds to stress. That does not mean menopause causes every blood pressure problem. It does not mean every woman after menopause will develop high blood pressure. But it does mean that after menopause, the body may become more sensitive to things that used to be easier to tolerate. A salty meal may affect you more than it did 10 years ago. A poor night of sleep may raise your pressure more than it used to. Pain, worry, alcohol, caffeine, or a new medication may push the numbers higher than expected, and this is where many women make the first mistake. They treat blood pressure as if it should be one fixed number, but blood pressure is not fixed. It moves all day long. It changes when you stand, walk, sleep, worry, eat, drink coffee, climb stairs, feel pain, rush to an appointment, or sit in a clinic waiting room. A single reading is only a snapshot. The pattern is the real story. One reading tells you what happened in that moment. A pattern tells you what your body may be doing over time. That is why one day you may see 128/76, and the next day you may see 154/86. Then it drops again, and you wonder if the machine is wrong. Sometimes the machine is part of the problem. Sometimes the cuff is the wrong size. Sometimes you measured too soon after coffee, stress, or movement. Sometimes you were talking, crossing your legs, or holding your arm too low. But sometimes the number is not wrong. Sometimes it is simply showing you that your body is under more pressure than it used to be. And this is the part I do not want you to miss. The goal is not to panic over one number. The goal is to notice whether the same pattern keeps returning. In a few minutes, I will show you a simple 7-day method that can help you separate one random high reading from a pattern that deserves a real conversation with your healthcare provider. But first, let's understand why this often begins after menopause. The first piece is estrogen. Most people think of estrogen as a reproductive hormone, but estrogen affects much more than periods and fertility. It also has an influence on blood vessels, inflammation, cholesterol, salt balance, and how easily arteries relax or tighten. Before menopause, estrogen does not act like a perfect shield. Women can still have high blood pressure before menopause, especially with family history, diabetes, kidney disease, smoking, high sodium intake, stress, poor sleep, or weight changes. But estrogen does provide a layer of support for the cardiovascular system. After menopause, estrogen levels fall and remain lower. For some women, this can make the blood vessels less flexible over time. Think of a garden hose. A newer, softer hose can handle changes in pressure more smoothly. An older, stiffer hose transmits pressure more sharply. Your arteries are far more complex than a garden hose, but the image helps explain why the top number often rises as women get older after menopause. That top number is called systolic blood pressure. It reflects the pressure when your heart squeezes and pushes blood through the arteries. In many older adults, especially after menopause, the systolic number becomes the number that slowly creeps upward. A woman may say, "My bottom number is still fine, so maybe it is not serious." But if the top number is repeatedly high, it still matters. That means the heart, brain, kidneys, and blood vessels may be exposed to more force over time. Now, this does not mean you should be frightened by one reading. It means you should not dismiss a repeated pattern as just aging. Age may be part of the story, but age should never be used as an excuse to ignore what the body is trying to show you. And if you are thinking, "But my blood pressure was normal for years," that is exactly why this matters. The change is often slow enough to be missed, but important enough that we should not ignore it. The second piece is salt and fluid. After menopause, some women become more salt sensitive. This means the same amount of sodium may raise blood pressure more than it did earlier in life. You may have eaten the same soup, bread, cheese, crackers, deli meat, or restaurant meals for years without seeing much change, but the body at 65 is not the same as the body at 45. The kidneys may filter a little less efficiently. The arteries may be less elastic. Hormonal signals that manage fluid balance may behave differently. Sleep may be poorer. Stress may be higher. All of these can make sodium have a stronger effect. And here is where many people get misled. They say, "But I hardly use the salt shaker." That may be completely true. But much of the sodium in a typical diet often comes from foods that do not look especially salty at first glance. Packaged foods, canned soups, sauces, breads, processed meats, frozen meals, cheese, snacks, takeout food, and restaurant meals. You may not taste extreme salt because the flavor is familiar, but your body still receives the sodium load. Here is a simple example. A woman has canned soup for lunch because it is easy. Later, she has a sandwich with processed meat. For dinner, she has takeout food because she is tired and does not want to cook. None of this feels dramatic, but by evening, she is thirsty. Overnight, her body holds more fluid. She sleeps poorly, wakes up, measures her blood pressure, and the number is higher. She may think the machine must be wrong, but the body may simply be showing the effect of a high sodium day. This is why I often suggest one practical step before making everything complicated. Choose one sodium swap, not 10 changes, just one. If you eat canned soup often, try a lower sodium version. If you eat canned beans, rinse them when appropriate. If you use sauces, use less or choose a lower sodium option. If you eat restaurant food, ask for sauce on the side. Small changes repeated daily can be more powerful than one perfect meal followed by old habits. But I want to be careful here. Do not switch to salt substitutes without asking your doctor or pharmacist, especially if you have kidney disease or take medications that can raise potassium. Some salt substitutes contain potassium, and that can be risky for certain people. This is why blood pressure advice must be personal. A good plan for one person may not be safe for another. The third piece is weight distribution. Many women feel upset after menopause because their waist changes even when they do not feel they are eating much more. This is not imagination. After menopause, fat can more easily collect around the abdomen. Abdominal fat is metabolically active, which means it can affect insulin resistance, inflammation, cholesterol, and blood vessel function. But I want to say this clearly. This is not about blame. I do not want any woman listening to hear, "This is your fault." That is not the message. Your body has changed. Your hormones have changed. Your sleep may have changed. Your daily demands may have changed. And many women are also caring for spouses, grandchildren, parents, or their own chronic pain. So the goal is not shame. The goal is to reduce pressure on the heart and blood vessels in ways that are realistic for older adults. For seniors, the priority is not extreme weight loss. The priority is strength, balance, nourishment, steady energy, and habits you can actually keep. A little more protein at breakfast can help. A shorter evening snack can help. A 10-minute walk after meals can help. Fewer sugary drinks can help. More vegetables at 2 meals can help. Gentle strength exercises with light weights or resistance bands can help if they are safe for you. None of these sound dramatic, but they can help the body handle blood sugar, fluid, and blood vessel tone more steadily. And this brings us to one of the most overlooked reasons blood pressure changes after menopause: sleep. If you remember only one section from the middle of this video, remember this one. Sleep is not a luxury. For blood pressure, sleep is part of treatment. Many women sleep differently after menopause. Hot flashes, night sweats, bladder trips, joint pain, anxiety, snoring, and early waking can all break sleep into pieces. You may spend 8 hours in bed, but that does not mean your body received 8 hours of restorative sleep. When sleep is poor, the nervous system becomes more alert. Stress hormones may stay higher. Blood vessels may tighten more easily. Pain may feel stronger. Food cravings may increase. The next morning, blood pressure may be higher before the day has even started. This is why morning blood pressure can be so confusing. A woman may say, "How can my blood pressure be high? I just woke up." But the body was not doing nothing overnight. It may have been struggling through hot flashes, repeated waking, pain, bladder symptoms, alcohol-related sleep disruption, or poor oxygen levels. This is where sleep apnea deserves special attention. Sleep apnea is not only a men's problem, and it is not always obvious in women. After menopause, women can develop sleep apnea even if they do not fit the old stereotype of loud snoring. Some women notice morning headaches, dry mouth, daytime fatigue, frequent waking, poor concentration, or blood pressure that becomes harder to control. Sometimes a partner notices pauses in breathing. Sometimes nobody notices at all. So if your blood pressure is rising and you are also waking, tired, snoring, waking often, or having morning headaches, it is worth asking your healthcare provider whether sleep apnea could be part of the pattern. Now, before you blame menopause alone, we need to look at the next piece: stress. And I want to explain this carefully because many people misunderstand it. When we say stress can raise blood pressure, we are not saying the problem is all in your head. That phrase is unfair. Stress is physical. When you are worried, grieving, rushed, lonely, in pain, or caring for someone else, your body releases signals that prepare you to respond. Your heart rate may increase. Your blood vessels may tighten. Your breathing may become shallow, your muscles may tense, your blood pressure may rise. In a younger body, pressure may return to baseline more quickly. In an older body, especially when sleep is poor and arteries are stiffer, the pressure may stay elevated longer. That is why I often ask patients a different question. I do not only ask, "Is your blood pressure high?" I ask, "When does it rise?" Some people are high only in the clinic. Some are high after watching the news. Some are high after a difficult phone call. Some are high when they are in pain. Some are high before morning medication. Some are high at night. These details matter because they show the pattern behind the number, and memory is not enough. Memory tends to remember the scariest reading. A written log tells the story more calmly. The next piece is medication and daily substances. As people get older, they often take more prescription medicines, over-the-counter medicines, vitamins, herbal products, and pain relievers. Some of these can affect blood pressure. Certain anti-inflammatory pain medicines can raise blood pressure in some people or make blood pressure medication less effective. Decongestants for colds can raise pressure. Steroids, some antidepressants, stimulants, certain migraine medicines, and some supplements can also play a role. Licorice root can raise blood pressure. Too much alcohol can raise blood pressure. Nicotine raises cardiovascular risk. Caffeine can temporarily raise blood pressure in sensitive people, especially if they measure too soon after drinking it. This is why I like older adults to bring every bottle to a medical appointment. Prescription medicines, over-the-counter pills, vitamins, herbal products, cold remedies, sleep aids, pain relievers, supplements, not because everything is dangerous, but because your doctor or pharmacist cannot protect you from interactions they do not know about. And please do not stop blood pressure medication just because one reading looks better. Often, the reading looks better because the medication is working. Stopping suddenly can be dangerous with some medications. Any change should be discussed with your healthcare provider. Now, before you worry about medication changes or a strict diet, we need to check something simpler. Are you measuring in a way that gives you a number you can trust? This is a very common problem. A cuff that is too small can give a misleading reading. Measuring over clothing can interfere with accuracy. Crossing your legs, talking during the reading, holding your arm too low, measuring right after coffee, measuring right after exercise, or measuring while upset can all make the number less reliable. So here's the calm way to do it. Use an upper arm cuff, if possible, with the correct cuff size. Sit quietly for 5 minutes before measuring. Keep your back supported. Keep both feet flat on the floor. Do not cross your legs. Rest your arm on a table so the cuff is at heart level. Do not talk while the machine is running. Take 2 readings about 1 minute apart and write down both numbers. Also write down anything that may matter: poor sleep, pain, stress, salty food, alcohol, missed medication, exercise, or caffeine. This turns your blood pressure log from a list of numbers into a useful health story. What you do not want is panic checking. Some people see one high number, become frightened, check again, become more anxious, check again, and then the number rises because the body is now alarmed. That cycle does not help. Calm tracking helps. Repeated panic checking does not. Now let's make this practical. Instead of trying to remember medical terms, think of 4 everyday questions. Are my arteries stiffer? Am I holding more fluid? Is my body exhausted or under stress? And am I measuring correctly? That is the simple framework. The first question is about arteries. After menopause, arteries may become stiffer and the top number may rise. Your response is to protect the arteries with regular movement, heart-supportive eating, not smoking, limiting alcohol, managing cholesterol and blood sugar, and taking medication properly if it is prescribed. The second question is about fluid. Your body may hold sodium and water more easily. Your response is to reduce hidden sodium, avoid very salty meals, watch for swelling or sudden weight gain, and ask about potassium safety before making major diet changes. The third question is about exhaustion and stress. Poor sleep, pain, emotional strain, and low daily strength can all push pressure upward. Your response is to take sleep seriously. Ask about sleep apnea if symptoms fit. Manage chronic pain safely. Keep muscles active, and build routines that help the nervous system settle. The fourth question is about measurement. Your response is to use the right cuff, sit correctly, avoid common mistakes, and look for patterns instead of reacting to one number. Now here is the 7-day blood pressure picture I promised you. For 7 days, unless your clinician gives different instructions, measure in the morning and evening. Sit quietly first. Take 2 readings 1 minute apart. Write them down. Beside the numbers, add short notes: sleep quality, pain, stress, salty meals, alcohol, missed medication, caffeine, and movement. By the end of 7 days, you are no longer guessing. You can bring that pattern to your doctor or pharmacist and have a much better conversation. Instead of saying, my blood pressure is all over the place, you can say, it seems higher in the morning after poor sleep, or it rises after salty restaurant meals, or it is high before my evening medication, or it drops when I stand and I feel dizzy. That last one is especially important. Some older adults have high blood pressure when sitting, but a big drop when standing. This can increase the risk of falls. If you feel lightheaded when you stand, tell your healthcare provider. Do not simply ask for stronger medication without mentioning dizziness. Good blood pressure care protects the heart and brain, but it must also protect you from falling. Let me give you a real lifestyle example. A woman I will call Margaret came in because her readings had suddenly gone strange. She was 67, postmenopausal for many years, and she felt she had not changed much. But when we looked closely, several things had changed. Her husband had been ill, so she was under more stress. Her sleep was poor. She was eating more canned soup because it was easy. Her knees hurt, so she walked less. She had started taking an over-the-counter pain reliever several days a week, and on top of that, her cuff was too small. Nothing about Margaret was careless. Her body was simply carrying more load from several directions. Once she saw the pattern, she stopped blaming herself. She stopped feeling as if her body had betrayed her. And she started making changes with her clinician. That is what I want for you as well. Not fear, not shame. A clearer picture. Now, what can you do this week if your readings are often higher after menopause? Start with one sodium swap. Choose one food you eat often and find a lower sodium version or reduce the portion. Then add one gentle movement habit. A 10-minute walk after lunch or dinner is enough to begin. If walking is not safe, seated exercises or light household movement may still help. Then protect sleep as if it matters, because it does. Keep a regular wake time. Reduce late caffeine. Limit alcohol in the evening. Cool the bedroom if hot flashes are a problem. Talk to your clinician if snoring, frequent waking, morning headaches, or daytime fatigue are present. Next, review medications and supplements. Ask your doctor or pharmacist one simple question. Could anything I take be raising my blood pressure or interfering with my blood pressure medicine? That one question can prevent months of confusion. And finally, do not separate menopause symptoms from blood pressure completely. If hot flashes are severe, sleep is broken, mood is low, weight is changing, and blood pressure is rising, these issues may be connected. Hormone therapy is not a blood pressure treatment, and it is not right for everyone. But menopause symptoms deserve a real medical conversation. You do not need to suffer quietly or feel embarrassed to ask. Before we finish, I want to make the urgent warning very clear. If your blood pressure is extremely high, such as around 180/120 or higher, especially if it remains high after resting, or if you have chest pain, shortness of breath, severe headache, weakness, confusion, vision changes, fainting, or trouble speaking, seek urgent medical help. Do not try to manage that at home with garlic, tea, breathing tricks, or extra medication unless a clinician has given you a specific plan. Home remedies are not emergency care. For the more common situation, readings that are mildly or moderately high again and again, the best next step is calm measurement, careful notes, and a plan with your healthcare provider. If you know another woman after menopause who is confused by changing blood pressure numbers, share this video with her. Sometimes one calm explanation can prevent months of fear, guessing, and unnecessary worry. Let me close with this. You are not weak because your blood pressure changed. You are not failing because your body is different after menopause. You are receiving new information from your body. And information is useful when we respond to it early. Menopause does not mean your body is broken. It means your body has entered a new hormonal and vascular chapter. In that chapter, blood pressure may become more sensitive to sleep, salt, stress, pain, medication, weight changes, alcohol, caffeine, and artery stiffness. You cannot control every factor, but you can control more than you may think. You can measure correctly, you can keep a useful log, you can reduce hidden sodium, you can move gently and regularly, you can protect sleep, you can review medications, you can ask about sleep apnea, you can treat pain safely, you can discuss menopause symptoms without shame, and you can work with your healthcare provider before a small pattern becomes a larger problem. So, if your blood pressure has changed after menopause, do not ignore it and do not panic over it. Measure the pattern, look for the reasons, respond early, calmly, and safely. That is how we protect the heart, the brain, the kidneys, and the years ahead. And before you go, leave a comment with just one word: morning, sleep, salt, stress, pain, or medication. Which one do you think affects your blood pressure the most? Your answer may help another woman recognize a pattern she has been missing.